Okay, so the landmarks that you're looking for a chest tube are going to be your mid-axillary line and around the nipple line. So on women, that's a little bit variable, so you kind of have to estimate a little bit, but we're looking for this area right here. So I want you guys each to come up and feel the ribs. So the ribs kind of go at this angle. And so I want you to come up and feel the space. So we're gonna go about right here. Feel the space in between the ribs and feel the way that the ribs go. You guys all wanna come up. So ideally you would also have somebody kind of moving the breast tissue out of the way. Just tape for that. Okay, so I would sterilize all of this, right? So I'm looking for, so you can feel the ribs, looking for this area in between the ribs. And so all of the blood vessels and nerves run along the bottom side of the ribs on the interior side. And so you want to hit the top part of the rib because you don't want to catch any of those blood vessels or nerves when you go into that space. And so you want to come over the top of a rib as opposed to going under the bottom of a rib so that you miss all of those neurovascular bundles. Okay, so this is the area where I want to actually enter the pleural cavity. And so I'm actually going to come down from that a little bit. And the reason for that is that eventually if this patient recovers, I don't want a straight line going into their pleural cavity. I want a flap so that when we pull that tube, it's not a straight line in that can keep leaking. It's got a flap that can close down. So, so if this is where I want to go, then I'm actually going to make an incision here. So the incision has to be just through the skin. It has to be at least big enough for your finger to go in. If I'm doing this under duress, I'm going to make a bigger hole because I'm not worried about how pretty it looks and how small the hole is. If I have more time, then I'll make a smaller hole so that later on the patient doesn't have as big of a scar. Okay. So once I have my incision made, I'm going to take a pair of curved clamps and I'm going to actually just blunt dissect up into the area that I want to go. And then I'm going to feel for where that rib is. And then it takes a lot of pressure to get into that space. But so now I'm in the pleural cavity. I'm going to open these wide to widen that space and then pull out. So now I should be able to get my finger into that space and feel around and make sure that there's no adhesions between the lung and the pleural space. There's a couple of different ways of doing this. Some people like to take a pair of clamps and use this as a guide. I don't find that helpful, but you'll see people do that. I think it's easier just to find the hole with my finger and then mimic that with the chest tube. Now her lung is inflated, so it's really going to be hard to get in there. If the lung was not inflated, then it would be super easy to get this through. We're in the space, but I can direct it up. So you want to direct it up towards the apex of the lung. Yeah, she's got lung tissue in the way. There we go. Okay. So this would go in a lot further if her lung were not completely inflated.
Going toward the apex, is that because once the lung starts to inflate again?
That's where the air is going to go. Yep. Yep. So you want to, ideally, you're going to have the tip of this up here. It's not going to go because her lung is fully inflated. And maybe, oh, there we go. Okay. Yeah. Okay. So from here, you want to secure it in place. All right. So the way that you secure this in place is with 2 sutures. So, and basically you're trying to like make this hole close down around the tube that you just put in. So however big your tube is, you're going to want to place your sutures near there.
Just right below it?
Yep. Those are the worst scissors ever. Okay, so you're going to do a knot to secure to close the hole a little bit. And then you're gonna basically do like a shoestring tie to secure the tube. Cut that about an inch. You do the same thing on the bottom. Okay, so once you have that hooked up, so this is gonna go on here, and then I'm gonna unclamp it. And so this will be hooked to suction. So the way that you dress this, and this just keeps things from leaking from around the tube. Okay, and if somebody can grab, I need 2 of these. The gauze. So that Vaseline impregnated gauze just goes around there to keep it from leaking. There you go, perfect. All right, so this goes on one side. This goes this way. Of course, it's not going to stick to her, but you get the idea. Thank you. Thank you. And so this, I just use it to secure it to the patient so that if somebody steps on it, it doesn't yank it out. And that's it.